Hello, welcome to part 34 of Clinical Physiotherapy MCQ series. Here, we'll be discussing day-to-day clinical scenarios with detailed explanation. Now let's move to question number 166. A 22-year-old long-distance runner visits a physical therapist because of constant pain in her Achilles tendon. The physiotherapist performs the Thompson test to examine the integrity of Achilles tendon by squeezing the calf. What does the positive sign of Thompson's test indicate? Option A. Achilles tendon rupture. Option B. Calcaneo fibular ligament sprain. Option C. Deltoid ligament injury. Option D. Deep vein thrombosis. And the answer is Option A. Achilles tendon rupture. Explanation to this question is a Achilles tendon rupture is a complete or partial tear that occurs when the tendon is stretched. Now let's move to question number 167. A physician notes a vertebral fracture in the X-ray of patient involved in a car accident. The fractured vertebra has a Bifid spinous process. Which of the following vertebra is most likely to be involved? Option A. 4th lumbar vertebra. Option B. 5th cervical vertebra. Option C. 12th thoracic vertebra. Option D. 1st sacral vertebra. And the answer is Option B. 5th cervical vertebra. Explanation to this question is bifida spinous process are found only in cervical spine. Now let's move to question number 168. During gait evaluation, a physical therapist notes that a patient demonstrates a short stepper length with the right lower extremity. Which of the following problem is most likely the cause of the gait deviation? Option A. Right iliopsoas contracture. Option B. Painful left knee. Option C. Decreased angle propionation on the right. Option B. Left gluteus medius weakness. And answer is Option B. Painful left knee. Explanation to this question is right iliopsoas contraction may cause a shorter step length with left lower extremity, but not the right lower extremity. Left knee pain will cause the patient to spend less time in left-sided stance, as the patient will try to minimize the time spent in the stance, weight bearing on the knees, to minimize the pain. Therefore, the patient will take a shorter step with right lower extremity. Decreased angle pronation would not have an effect on right-sided step length. Gluteus medius weakness would be seen as an increase in lateral pelvic tilt, not step length. Now let's move to question number 169. A physiotherapist recommends footwear for a patient with foot pathology. He recommends a high and wide toe box, middle arch support, small to no heel, and a conduit posterior counter. This type of shoe prescription would be most beneficial for patient diagnosed with Option A. Pes cavus. Option B. Sesamoiditis. Option C. Hallucis valgus. Option D. Metatarsalgia. And the answer is Option C. Hallucis valgus. Explanation to this question is in hallucis valgus deformity, the big toe is increasingly pushed towards the second toe, creating a bony prominence on the outside of the foot. Hallucis valgus shoes helps alleviate the pressure on the bifurcations, wide the toe box, soft and stretchable upper. Also, inner soles with anatomical arch support reduces overpronation, straighten the foot and toes. Now let's move to question number 170. A physical therapist evaluates 66-year-old female who has a history of severe head trauma following a motor vehicle accident. The patient has difficulty with rapid alternating movements while performing neurogenic testing. The best term to describe this specific impairment is Option A. Ataxia. Option B. Dysmetria. Option D. Dysarthria. Option D. Dysdiadochonesia. And answer is Option D. Dysdiadochonesia. Explanation to this question is correct answer is option D. By definition, dysdiadochonesia is an impairment specifically involving rapid alternating movement such as pronating and supinating one hand quickly. Why other answers are wrong? Ataxia is a global term compromising inaccuracy and decomposition of the movements. Although this embraces many forms of movement impairments, It is too general to describe difficulty with rapid alternating movements. Option B. Dysmetria is defined as a decreased ability to judge distance and range. Option C. Dysarthria is defined as motor impairment involving muscles used in speech and breathing. So that's all for today. If you have any doubts, please mention in the comment box. For further learning, keep in touch with the channel. See you in the next part. That's part 35. Bye bye. See you. Thank you.